You're listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. I'm Bill McIntyre here with Jon Gallo, bringing you news stories about Long Island and about Long Islanders. With us today, we're happy to be joined again by Nassau County Health Commissioner Dr. Lawrence Eisenstein. Hi, Dr. Larry. How are you?
Hi, thanks for having me. It's great to be back with you.
Yep.
Thank you. Thank you so much for joining us.
Definitely. Really appreciate it. And it seems like there's been a lot of good news since we last spoke in March. I know, thankfully, it looks like the state COVID rate is back under 1%. It seems to be, about at the lowest since before since early September or so, and about 55% of Long Island's population have been at least partially vaccinated. So those are all great things that we're all happy. And I know that your office have been very, essential to having that come to fruition. But let's just start out by laying out to our listeners an overview of the latest CDC and New York State guidance. Some new things came out this week in terms of mask and occupancy information.
Yeah, so a lot of guidance came out this week. But the most important to discuss clearly is the new mask guidance. And I think common sense is prevailing here. And we know that people who are vaccinated are really well protected especially really well protected from serious disease, hospitalization, or death. The death rate has dropped dramatically. The hospitalization rate has dropped. I'm so excited. Today we're down to just 10 people on ventilators at all of our 11 hospitals combined.
Wow.
And it wasn't long ago that was many times that. And look, I'd rather there be 0 people on ventilators, but our total hospitalization numbers are in the 80s today combined at all 11 hospitals. And just a couple of months ago, we were over 800. So, and of course, last spring, we were over 2,500. That's a whole other story. But to put it into perspective, people are not getting as sick. A big part of that is because right now, more than 86% of our senior citizens identified as 65 or over are vaccinated in Nassau County. So the people most at risk, the people that are most likely to end up hospitalized are not, because they're protected. And I think, so when you have that kind of protection in the community, it makes sense to smartly reopen, to smartly get back to life. And that's what I think the mask guidance does. It says, look, if you're vaccinated and you're hanging out with vaccinated people, it is very unlikely that anybody's going to contract disease. It's really, really unlikely that anybody's going to spread disease. And even in a circumstance like we heard, all the rage last week was 9 members of the New York Yankees who were vaccinated tested positive. Yeah. 8 of them had no symptoms at all. But for Major League Baseball's very intense testing protocols, which I fully understand and get, they wouldn't even be tested in real life, and they're not likely to spread disease. And somebody said, well, but it's 9 of them. But if you consider that the traveling party is probably 50 or 60 people, it's well within the percentages that we would expect to see. Nobody was seriously ill. 8 out of 9 had no symptoms at all. The vaccines are working to do what we need them to do. If you're vaccinated, you're not going to die of COVID. You're not going to be very sick from it. And for, now that teenagers can be vaccinated, it's huge. The biggest thing is, well, people say to me, well, I'm worried. I don't want my 12, 13, 14, 15, 16-year-olds to be vaccinated. What's the benefit? If they're exposed, they don't have to quarantine. They're not going to miss their summer jobs. They're not going to miss their summer school auditions. If you go on a family vacation, after all this time, we're finally ready to travel and live again. And imagine you get off that plane in Orlando on your way to see Mickey Mouse, and you get the call that your 13 or 14-year-old has to quarantine because they were exposed. Well, if you're fully vaccinated, and you can be, if you get vaccinated today, you can be fully vaccinated before the 4th of July. You have all summer. Then you won't have to quarantine. Even if you are exposed, you won't have to quarantine. The only case you have to quarantine is if you have symptoms and are sick. And quite frankly, anybody who has any contagious illness should quarantine, stay away from the public. So the new guidance takes that and says, we know how protective these are. If you're vaccinated and you're going to be with vaccinated people, Go have fun. You don't need to wear a mask. If you're in a location where the risk of transmission is low, you don't need to wear a mask. Outdoors, we know is safer than indoors. We said that all of last summer. But even again, if you're outdoors and you're vaccinated, you're walking down the street, you don't need to wear a mask. There are some places still where mask rules are still in effect. Schools is the big one, and a lot of parents are concerned about that. That's the state guidance, and it is what it is. It makes sense from the point that most school-age kids, especially everybody under 12, is not vaccinated. We want kids back in school, but in order for school to work, it has to be safe and there has to be limited exposure. And we may get to the point before September where it's not necessary to mask in school. But for right now, schools, hospitals, and particularly mass transit, and all transit, public transit, buses, trains, airplanes.
Yep.
Makes sense. Airplanes still need to wear a mask. In jails and homeless shelters still need to wear a mask, those traditionally high transmission places. But in other locations like restaurants, the mask mandate doesn't exist for anybody who is vaccinated. For people who are unvaccinated, the governor has made it on the honor system. We're asking people to be smart, to do their part as part of a community. When you're out in public, you're part of a bigger community. And it is everybody's responsibility to try at least not to get their fellow community members sick. And so that's what that's about. But, so when I'm asked, what's the right answer? Should we mask? Should we not mask? The right answer is everybody's got to find their own comfort level. Everybody has to figure out what setting they're comfortable not wearing a mask and what setting they would rather wear a mask. And, nobody should begrudge anybody if they choose to keep wearing the mask. If it provides reassurance and comfort to somebody, why would I care if somebody else is wearing a mask?
Exactly.
I think that's one of the things that's interesting here is I had the opportunity to be in Japan before any of this happened. And masks are a part of their culture.
Yeah.
We saw a lot of them, and it didn't have to do with COVID. It was somebody either feeling ill and they take that responsibility seriously. Now, in New York, specifically, we learned that masks work. We had 700 people a day at one point plus dying, and we've gone down. It was the masks that did that. I would love to see this become a part of our culture, where if you're feeling a little under the weather, maybe you're not sick enough to stay home, you still want to go to work, you still want to go, well, put a mask on. What's
like at the hospitals? A lot of times, when you're visiting people, there would be a place where you can get a mask if you thought you maybe were coming down with a cold or something, because you don't want to expose other people. That makes sense.
But
that's one of the things I when people ask me, what should I do? I just tell them, just make sure you have your mask in your pocket, because you're never going to know. You might be going to a place and you have no intention of stopping off for a quart of milk, but then you might decide you want to. Guess what? You need a mask, or it's possible you're going to need a mask.
Especially if you're in a setting. Yeah, they work. And especially if you're in a setting where all of a sudden somebody around you sneezing and hocking.
Oh, my God.
For your own comfort. There are places that I think masks are going to become part of the culture. I was talking to a hospital executive yesterday, and it was his prediction. So I give him the credit, not mine, but I agree with it. Hospitals will probably always have to have masks because we know it works. And we know how much disease is transmitted in hospitals. And so we have a mechanism. It's not unreasonable to ask somebody visiting a hospital from the outside, somebody who's healthy and maybe harboring something that their body's able to fight off, but the hospitalized patient can't. And that holds true for hospital staff members too, young, healthy hospital staff members. It wouldn't surprise me if medical facilities and hospitals have that requirement indefinitely. I think you're going to see when people especially travel on airplanes, I've already stated publicly, it's now that we know how well masks work, and you talked about Japan and other countries in Asia where that was part of the culture, they had it right. They know it. They got it right. And if I'm on an airplane, it probably means I'm going somewhere fun. Why do I, not only COVID, but why do I want a chance catching any virus if the mask protects? There was no flu season this year. There was literally no flu season. There were a handful of cases in a country. Normally there's tens of thousands, hundreds of thousands. There's normally 30 to 40,000 deaths in the United States each year from flu. We had nothing. because all of these measures work. So if I'm on an airplane and you're sitting next to me wherever we're going, I'm the guy wearing a mask for the rest of my life because I don't want my vacation ruined because 2 days after I land, I've got a cold. I don't even want a cold when I'm on vacation.
No, exactly. Like any coronavirus, not just COVID. Like you said, you don't want to have it be, interfering with your holiday plans and your family's again, thoughts of having a nice vacation. So that makes a lot of sense. Let's remind our listeners that they are listening to This Week Long Island News here on 90.3 WHPC, Voice of Nassau Community College, with Bill McIntyre, myself, Jon Gallo, and joined by the Nassau County Health Commissioner, Dr. Lawrence Eisenstein. So that's good to know. And, I know we talked about last time, and we are moving in the right direction in terms of getting, over 50%. And I know there's this ideal term of, herd immunity, around 75%. But I know you've also discussed that maybe isn't the end all be all. There's also other issues about community spread and just trying to minimize them, and knowing, like you said, how much of the population is children who aren't eligible yet. It's going to take some time. But in terms of, trying to fill that gap, I know that you and County Executive Curran have been a part of a couple of initiatives specifically targeted at youth and college students and high school students. And I know you've been doing some work right here on Nassau Community College. So you want to talk about how that plays into trying to, again, get that rate of vaccination up and do what it needs to do?
Yeah, so we just finished Student Days, and Student Days was a 4-day event that we planned in partnership with Nassau Community College. You guys were a great host, as you are. And right now, today, we have a second dose pod at the CCB building, which is nice. Our core vaccination site. By the time all is said and done, I think we'll have done well over 50,000 vaccinations on the Nassau Community College campus for our residents of our county. We're very appreciative. It's not our only site, but it is going to end up being our most productive site. And we're there doing second doses today. And we won't turn somebody away now if they come in for a first dose. We're no longer different. There's now what's called universal dosing. So we used to get certain vaccine for first doses and certain vaccine for second doses. It was when vaccine was limited, you had to do an accounting to make sure that there was enough. Now there's no limit. We have enough vaccine. And so if anybody wants to go, to our events, first or second dose, you're going for a second dose, bring a friend who's unvaccinated. We'll give them a first dose and worry about the second dose another time. But we just finished 4 days last week of Student Days geared towards what was originally 16 and 17-year-olds when they became eligible. But while we were planning it, 12 to 15-year-olds became eligible under emergency use. And so we expanded it. We asked every high school to choose one or two or three vaccination ambassadors. Many did. I had the pleasure of meeting with them one evening, and I did a formal training for them. And their job was just to be a source of inspiration and education, not to go pick fights with people, not to push people. But if they found other students who just had questions or concerns and needed a place to go among their peers, they did. The vaccination ambassadors came, and many of them got vaccinated with us. And at the Nassau Community College Student Days site, Northwell provided the vaccinations. They have the Pfizer vaccine. They have been a great partner all along. You were the host site, Nassau Community College, and we're incredibly grateful. And in that short time, those 4 days, we did 1,333 doses, of which we believe the great majority were between 12 and 17. We can get the exact numbers, but almost all of it was high school and 12 to 15-year-old kids. 1,333 doses at a point when it's become hard to find people to vaccinate. Yeah. Everybody who really wanted to be vaccinated now is vaccinated. And so we have a lot of our population is vaccinated. Of our 18 and over population, more than 72%. So you start to talk about herd immunity. And herd immunity includes people who are immune because they've had COVID. And it includes people who are immune because they're vaccinated. We don't know the exact number of people who've had COVID because some had it and we don't know. Some might have not made antibodies. But now we talked last time that it's hard to achieve herd immunity when 20% of the herd is under 18 years old, can't be vaccinated at all. Now that we're down to 12 years old, I think it's possible. Now, we still don't know what percentage point is the magic number for this virus. Is it 75%? Is it 80%? Is it 85%? somebody listening might say those numbers are all really close. Yes, but the way herd immunity works, it's very different, 75% and 80% or 85%. So every single person we get vaccinated gets us closer. I would estimate now, so that number that I gave you, 72% of our population over 18, and of course now many from 12 to 17 have started to be vaccinated. Overall, we're at about 58% of our population has received at least a dose. That's all inclusive, including kids who are ineligible. We're at 58%. We know a significant number of others are immune because they've had COVID. I actually now think we can achieve herd immunity. So we just keep pushing. Every Wednesday now, we're coming out of Nassau Community College. In the next couple of weeks, we're going to finish up our second doses there, and then we're going to give you back your wonderful building because you have to start planning for students coming back to campus, which is great. And our pods, we're not getting 700, 800, 1,000 people like we were a short while ago. So we're going to come back to our own headquarters because we could handle the size of the demand from our own headquarters. And every Wednesday evening now, 5 to 7:30, we're taking walk-ins. We're putting signs up on Old Country Road and Franklin Avenue. And we're offering walk-ins of both Johnson & Johnson and Moderna. People can pick which they want.
That's nice.
There are some people who have a preference. We don't have Pfizer because we don't have Pfizer. Northwell in the state has Pfizer. So for 12 to 17, this doesn't work. But every Wednesday evening, people can come to the health department on County Seat Drive and just show up, and we'll give them a vaccine. And anybody who wants a vaccine now should be able to find it. For people that don't have transportation, Uber and Lyft are doing free rides.
Big partnership.
So we're really trying to get to those people who have been saying, yeah, maybe I will, maybe. There's a certain segment that are adamant they're not going to be vaccinated. We respect that. But for anybody who there's even a little glimmer of hope, we're going to try and show them how this helps them and helps their community, and we're trying to make it as easy as possible.
Exactly.
So the incentives, people are looking at getting their free lottery ticket. And
free beer in Suffolk County.
I mean, Suffolk County had a shot and a beer.
Yeah.
And,
a lot of creativity going on.
And the blowback is that the people who already got vaccinated are a little ticked, that, hey, I did my civic duty and I did my thing that would protect people. And you're going to reward the naysayers and the,
I hear it, but at the same time, also you have those folks, who are very hesitant, where you don't know if a beer is going to bring them to the table or a lottery ticket. But for anyone, like you said, Dr. Larry, that is on the borderline, and they say, well, you know what? Again, it doesn't hurt, and here's these extra little perks coming my way, whether it's a Krispy Kreme, for a year or whatever it may be. If that's what it takes to get someone to become part of again this growing herd immunity that we're trying to get here, then I guess we'll take it. But is there anything that you could talk about in terms of those incentives? I know that they've been kind of discussed at the county level a little bit, but is there something?
We've talked about it, and we've dabbled with some ideas. We laughed about the concept of shot for a shot, to get our bars engaged. And the point for that was, we still know that the population that's most spreading and least vaccinated of the eligibles is our 20 to 30-year-old group.
Sure.
So.
Yeah. College bar maybe or something.
The thought was they want to go out back to the bars. They want their stuff. Now that we've reopened the restaurants and bars on basically unlimited, it's different. But this was something we were thinking about as a means of getting to where the bars and the restaurants can reopen. Incentives is part of public health. We've done it for a very long time. You can debate what's the best way to do it. For right now, it benefits all of us if everybody's vaccinated. So the fact that I protected myself very early on and got vaccinated, sure, I would love that free lottery ticket and win the $5 million. But, it's as John just said, it really is to just push those people who are thinking about it and might do it. And now they will do it. And that gets us all back to a normal summer and a normal society. So, public health has used incentives as a means for the history of public health. It's not new. Yep. And for people that say, oh, I wish I got mine, you got your vaccine. You were protected from disease. That's your reward all this time. And you've been able to go places that others have not. So,
I think people are going to find that out, right? They're going to find that out as they go to travel. When they get to an airport and realize that they're not vaccinated and somebody's asking them questions or wants to see their card. Yeah. And you're right, it upends their whole vacation because things are going to change if you're not prepared for that.
Exactly.
I have two questions for you, though. let's, because the story circulated pretty widely, the 9 Yankee guys that were tested positive. Now, what is the contagion factor there? Or somebody who's vaccinated and actually gets COVID, can they spread it?
So we didn't know at first, but the studies more and more are very clearly showing that people who are vaccinated are not likely to transmit disease. I can't tell you the risk is zero, but so let's talk about what the test as positive shows. So somebody's vaccinated, how could they be sick? 8 of these 9 people were not sick. Exactly. They were just tested because there's a standard protocol by their job that they're going to be tested a certain amount of times per week.
Right.
If you're vaccinated and somebody in your office is positive with COVID, if you're vaccinated, we don't test you, we don't quarantine you unless your job requires it. So what the test shows is that a swab found some genetic material of the virus in their nose. That does not mean they're contagious. It does not even mean that they're sick. Their body might be fighting it off. In order to transmit disease, with this virus too, we've learned that the amount of virus matters.
The viral load.
The viral load.
The load.
And that's not, for infectious disease doctors, that's not a new concept. We've seen that with HIV, the whole premise of HIV not being transmissible. You still have HIV, but if we get the viral load low enough, you're not going to transmit it. And so it's a similar concept, I think, except with HIV you treat with medication. This is preventive with a vaccine. We knew with the Johnson & Johnson studies that about 2/3, give or take, of people are fully protected, and about 1/3 tested positive at some point later on, but none of them got seriously ill. So the question of can they transmit, it's a very important question. The answer is it's very unlikely. If it were likely, you wouldn't see all the cases dropping. You wouldn't see all the hospitalizations dropping.
Right.
And even though 9 sounds like a lot, if the entire Yankee traveling party had Johnson & Johnson, and you have to assume with a thing like a baseball team where they're all in the same clubhouse and they're all in the same airplanes and they're all in the same dugout for hours and hours and hours. I know there's 28 players or 27 players on the roster. I know there's got to be 10 coaches. I know there's got to be 10 or 15 others. If it's only 9, that's less than 20% of the traveling party. And we know that the Johnson & Johnson vaccine is 2/3 protective completely from testing positive. But what that shows is a good thing. The vaccine is doing its job. 8 out of 9 of those people had no symptoms at all.
Exactly.
Even in the best case scenario, this virus is 50% asymptomatic. You know, so it works.
Makes a lot of sense, of course.
The other thing is people who previously had COVID.
Yeah.
Now they've recovered and some of those people will consider themselves protected because they had it.
But they're different strains also.
Yeah. So, what you both said is right. So here's the answer. The CDC is currently treating it that you're protected for 90 days. So for 90 days after you've tested positive, if you're exposed to somebody, you don't have to quarantine. For 90 days, you can go about as if you're protected. But because there are different strains and we think that the vaccine's immunity might be more broad, after 10 days of being sick, you're allowed to be vaccinated. Many doctors are saying wait the 90 days. But now the CDC changed it. After 10 days, you can choose to be vaccinated even if you've had it. But yes, if you've had COVID, if you don't know when you had it, there's no way to time the 90 days. But if you were sick and you tested positive, we consider you protected and you get the same privileges as if you were vaccinated for 90 days.
Exactly.
I see.
Okay, so there we go. So thank you for those explanations.
Yeah. My daughter was one of those cases. She got it, and I think they made her wait a month.
Yeah, it's changed. It's changed at that time. But
what's the thing? If my body has made antibodies, is there some kind of battle between what the vaccine will do and the antibodies that your body naturally made from having gotten COVID?
No, your antibodies might recognize the vaccine, and you might have an immune response, which is why some people might feel lousy after. People who've had COVID sometimes don't feel great after they get the first shot because you're having an immune response. But it's not dangerous to get the vaccine if you've had COVID.
Yeah, it's supportive. Okay. It doesn't have any negative effect.
But you can also,
thank you so much, Bill.
If you've gotten COVID and you got over it, is it possible you could get it again?
If you come across a strain that your body doesn't have immunity from, yes. And if your immunity wanes, and that's the key question. I keep getting asked about booster shots and can I get it? And we don't know yet. We don't know, is the vaccine going to protect you for we know it protects you for at least 6 months. And honestly, we think it's more than that, probably 9 months or a year minimum. But 2 years, there's no way to know. 3 years, there's no way to know. So nobody knows for sure yet if we're going to need booster shot. And nobody knows for sure if you've had COVID, how long is your protection? So that's why we know for 90 days it works. So that's where we stand.
Exactly. So we'll have to stay tuned. And that's what was going to be my last question. So thank you so much for answering it right there preemptively.
And you have to come back.
Anytime, guys.
Yep. We look forward to it.
The continuing saga of coronavirus.
But also hopefully as we moving towards some other issues like we discussed in the past, like opioid abuse and other important public health matters that do impact Long Island. So thank you so much again, Commissioner Dr. Larry Eisenstein.
Always
we really appreciate your time.
There you go, John.
A lot of good information as always. You know, it's always good to see how personable and kind of relatable he makes that information too. So it makes sense, you know, why he's been at the top position at public health for the county for as long as he's been. And again,
and now he's a rock star.
According, we had that off-air conversation about his daughter maybe not appreciating it as much.
But people recognize who he is.
Yeah, you know, kind of at the supermarket and stuff like that. But I guess it comes with the territory. And as long as, you know, people are, praising you and lauding your efforts, then I guess there's worse things, you know, I guess in reality to some extent. But I guess we'll let you be the judge of that. But either way, again, we certainly thank the commissioner and obviously Nassau County for letting him, you know, come on and have those questions answered, because certainly a lot of folks are answering it or asking those questions. They just don't have any real recourse on getting them answered. And that is definitely a very, very reputable, good source to get the info from. So, okay.
Well, and as it develops, you know, it'll be great to get him back on. We'll be jotting down our questions.
Yep.
You know,
there's always a lot more. But like he said, you know, kind of with the booster shot, which is kind of what I knew going into it, you know, and I know we had this conversation I've referenced before with Brodsky, Robert Brodsky, many, many months ago, early in this year. And that's kind of what the consensus is. It seems that it's going to likely need booster shots. It's just a matter of when and, you know, other questions in terms of logistics. But, you know, we'll see how it goes from there. But either way, like I said, definitely a lot of information to digest.
You know what, to some degree is refreshing, and I know it sounds weird, but when you ask a public official a question and they honestly tell you, we don't know.
Yeah, oh no, that's the best part, because that's when you start to lose trust. When you start to say that you know, and then something comes out contradictory and you can't explain away, you know, the fact that you didn't know the first time, then it erodes that public trust. It hurts, you know, credibility. But when you, again, just kind of lay it out there, and like I said, he makes it very personable. And you know, like I said, he is a Long Islander. He's not somebody who just came in from, I don't know, Birmingham, England or something like that last week. You know, it makes it, I think, hopefully easier. I heard him on, I'll just give them a plug, another radio station out in Long Island that, you know, we're friends with, that they were talking to him. And again, very layman spoke, you know, they called him, you know, you're the head honcho or whatever on health. And you know, that's how a lot of Long Islanders speak. You know, that's kind of how it goes. So, you know, we don't want to get too far in the weeds, but there is important information there, you know, when it comes to the science and things like herd immunity and, you know, like he said, the viral load and stuff like that. And he certainly,
I think what's interesting too is, you know, him talking about, you know, masks becoming a regular staple in hospitals.
Yeah.
I would really love to see, you know, somebody keep track of the number, because I didn't want to say it to him, but you know, the locals would say, if you really want to get a bad germ, go hang out at the hospital.
Well, that was always the question. That's what, you know, as we go on with him, you know, further, you know, down the road, there's always been these concerns of things like sepsis, things like gram
MRSA,
I believe. MRSA,
flesh-eating bacteria, and all, you know,
and these types of they called them like super bugs, you know, kind of in the common phrase, you know, where they're kind of antibiotic resistant and stuff like that. So there's plenty of other issues, like we referenced, on their plate over there. No pun intended, as they are the agency that also, you know, has oversight over restaurants and that type of safety. So there's a lot to speak about later, and that's what we'll do. But now let's segue into some of the other news today, because today we have a little bit more time for the both of us here, Bill, to kind of get into some of the other news that maybe, you know, either even ourselves didn't get a chance to really dive too deep into, or some of our listeners might have missed over the last week or so. So
we can exhale a little.
Yeah, no, totally. It's been great to have a lot of, again, newsmakers and electeds on, but certainly it's nice to kind of get back to the roots and talk about, what's being reported right now from a lot of our friends at Newsday and other local Long Island news outlets. So,
well, this one story is the other story, the first one that's listed on.
Yep.
Representative Lee Zeldin on Wednesday cast the only no vote by the Long Island congressional delegation on a bill creating a 9/11 type commission to investigate the deadly January 6th insurrection by Trump supporters at the U.S. Capitol. The bipartisan 1-6 commission, January 6th, the bill passed with the votes of all Democrats and 35 Republicans, including Representative Andrew Garbarino, the Republican from Bayport, despite the Republican leaders of the House and Senate coming out against it. Where it faces a hard road after Senate Minority Leader Mitch McConnell said Wednesday he opposes the, quote, slanted and unbalanced, unquote, bipartisan commission, a day after former President Donald Trump called it a Democratic trap. Zeldin, a staunch Trump supporter from Shirley, running for the Republican nomination for New York governor, said in a statement that bipartisan congressional investigations are underway. The Justice Department has arrested more than 400 suspects, and the architect of the Capitol is working to improve security. The duties of the proposed commission are already being carried out, but Speaker Nancy Pelosi wants to politicize this issue. Representative Garbarino and Long Island's 3 Democrats voted for the commission proposed, right? Garbarino, explaining his vote, said, what happened at the U.S. Capitol on January 6th was un-American and a direct attack on our democracy. At that time, I promised to work with my colleagues on both sides of the aisle to ensure that what happened that day would never happen again in our country.
So there's some developments. I know that we've been trying to obviously follow the Long Island connection to the event that unfortunately happened that day on January 6th. And this is kind of, I guess, where it stands at the moment. We know that we've talked at length about Congressman Tom Suozzi's experiences when we spoke with him recently, and when he was at the Capitol, and we saw that very compelling video of what seemed like a really surreal kind of insane kind of experience out on the Capitol kind of floor. But yeah, what do you think about that bill? Are you kind of surprised that he voted against it? Are you surprised that maybe Andrew Garbarino, the new congressman who took over for Pete King, voted in favor of it against a lot of other Republicans in his delegation? Or what are your thoughts on it?
Well, I mean, what would a commission like this do? It's going to uncover the truth. That's what we would all hope. Yeah, it would be the result. Why can anybody be against that? That I don't get. Yeah, unless, of course, you feel that something you did in that arena, whatever, all the activities that occurred around that happening, that somebody's going to look at what you did and say, that's the only reason I can see that people wouldn't want it to happen.
I don't know. I mean, the real question is, like you said, that generally more information is better because it could prove, your argument too. If you disagree with it, if you say, oh, no, this wasn't politically motivated, they weren't here because of President Trump, whatever, then in theory, more information could prove your argument. So
more information doesn't always just show guilt. It also shows innocence.
It can exonerate, of course. That's the whole argument with the body cameras. Our activists want them, but sometimes police want them too, because they say, well, they can show that this wasn't the way that it was claimed. So that I hear you on. And that's why, I know, Congressman Garbarino is getting a lot of praise. It looks like, from both sides.
I'll bet he's getting a lot of blowback from Republicans.
That's what I was going to say too, though. I'm not sure, if it's, necessarily, again, without its concerns from his voters too, to be honest. And you're a constituent of his, so that district pretty well, of course. And I'm sure not everyone will be as kind of happy that he voted that way because they were supporters of President Trump. But
right. I just don't know. I just don't know how the government can continue to operate under these conditions. Because all of these folks are sitting together in that Senate chamber.
Yeah, that's what you mentioned, Congressman Suozzi. Knowing like people like Marjorie Taylor Greene.
Well, those are the obvious ones.
Yeah,
I mean, she's a lunatic, in my opinion. So whenever she opens her mouth, it's fairly obvious that okay, cooler heads. Again, we need cooler heads. Yeah, I don't know how they could get. I would like to see a major media outlet. Well, we're not a major media outlet, but somebody to post the oath that these folks take when they take on this job. Because I think there are at least 146 of them in Congress that signed on to Louis Gohmert's bill in Texas about disenfranchising the votes of 5 million Texans because they didn't like the outcome of the election. And to me, every one of those people that signed on to that bill violated that oath. Obviously violated that oath. And an attempt to stop a democratic process in the Capitol. How do you ignore that and continue to go to work every day standing next to a guy who may be not just ideologically different than you, but close to being traitorous to democracy?
I mean, but I think the tough part is, and obviously listeners and, yourself and everyone can make their own determinations, but I guess that these folks who voted in terms of saying that the election, quote unquote, was rigged, and, that they believe that this, is kind of again, more spectacle and not as, I think some have even described it as, it was similar to a kind of not a field trip, but, in terms of like the general so, people can make what they want of those types of claims and they can see the videos and compare. But the point is that, I think just seeing the way that these folks who both believe the electeds and the electeds themselves, whether they believe it or they know that it's politically in their best interest in certain districts, that they're saying that they believe the election was stolen. So their constitutional duty in their mind might be to, we have to fight against this rigged election. And it's still a back and forth. I'm not obviously, making that argument, but I'm just saying that it's tough to argue with that when all you do is go back and forth and everyone, kind of, again, has a completely contradictory point of view.
Let's just say, I think that most of the people in government have proven that the one thing they're good at is getting elected. And I think that this has more to do with their either their fear or their, worries about their future life in politics. That has nothing to do with running the country now. It's hang on to the Trump coattails because that might get me into office next term.
Yeah, well, it certainly is a calculation that, Congressman Zeldin, again, from the 1st District in LI, is going to, be considering as he ramps up his run for governor from the Republican ticket. And he currently is the front runner in that race with a few other candidates kind of tossing their hats in recently. But yeah, no, like you said, that's a fair point, Like I said, because he just spins it back. Because people will say that they make it political, and then they'll just say, "Well, they make it political." And I think that's why people want to tune it out, and they kind of just get lost saying,
"Well." But I think that's part of the play. Let's make them so sick of it that they won't watch us anymore.
Yeah, exactly. No,
that's why I think the commission, the January 6th commission, it is important to find out exactly what the players did, and because I think you hear little snippets of stories. People opening doors for people to get into the Capitol, people giving tours of exactly where things were in the Capitol the day before the thing happened. There's a lot of information that needs to come out as to exactly who did what and who was where.
And hopefully,
so to me, it's pretty clear why people don't want it to happen.
Yeah.
And that just makes me suspicious.
No, I and that's hopefully, this still needs to get, it did, I believe, pass the congressional vote, I believe. It did. It passed the congressional vote and now it needs to go to the Senate. That's where we're at right now. So,
and it was 252, I think, to 175. So it didn't pass by a slim margin.
No, true. But it also has plenty of people in dissent, of course. But like you said, so that will all have to stay tuned on by definition, and we'll see what comes. And if it passes the Senate and in theory would then be signed by the president. And also I'll just mention, and we won't go too far into it now, we'll go and maybe cover it next time. But there was also another piece of legislation that was important that just got signed, I believe, yesterday by President Biden, which was a bill that was sponsored in the House by a Queens congressional representative, Grace Meng, regarding AAPI, Asian hate crime protection. So that's something that we did see there was bipartisan support on and did manage to, again, cross the threshold and get signed into law yesterday. So we'll have a longer update on that probably next week when we get a little more information about that. But let me just make a quick story, and then we'll hop into the other stories on that list there, Bill. But I just want to give people a quick update. Bill, you got something? What do you say?
Let's remind them they're listening to 90.3 WHPC, Voice of Nassau Community College. You're here with Bill McIntyre and Jon Gallo. on this beautiful Friday afternoon.
Exactly. Yep. Thank you for that. And let me just give a quick story recap. We'll have a little bit more of a deep dive on this probably again next week because it just kind of happened this week. But I just wanted to give an update on the school board elections, which was something a lot of parents obviously, had to make sure that they kept their eye on, and other Long Islanders, because it does impact them even if they don't have kids in schools. But I'll just say that according to News 12 reporting, over 100 school districts did go to the polls on this Tuesday for budget and school board votes. Some did fail to come to an agreement. I believe it's been reported that there are about 4 districts right now that have failed to pass their budgets, which are Wantagh, I believe the school district of 3 Village, apparently, Bridgehampton, and Northport/East Northport are the ones that still have to come back and try to find an agreement with their budgets. It looks like proposed increases would see property taxes go up an average of 1.3%, which is actually the lowest amount it's been in 5 years. So that might have.
Right. What's the ceiling? They're allowed to do 2?
I forget what it is, to be honest, offhand. But in terms of what we've been talking about, with all that federal money coming in and the state budget, granting a lot of what's called foundation aid at actually the highest amount that's ever been. The one thing is, and I know a lot of Long Island electeds were calling for, property taxes to try to be capped this year and have some of the federal funds go that way. I don't know how much the direct interplay is, but like I said, at least we know that that's the lowest in the last 5 years at 1.3%.
Right. Correct me if I'm wrong. I read a news story about, and it might have been on Newsday's page yesterday, about Laura Curran talking about giving $300 payments.
That is another one. Yeah. We have that one.
Of all the federal money. Yeah. Now, how come? Why didn't this idea translate to school taxes?
That's a fair question. And, I'll just say that to close the article, that the officials say that they were seeking smaller tax increases, given that the federal aid, again, had an impact, but knowing that it also was a one-time thing. There are a lot of issues that they say that prevented them from lowering those increases any further were due to, quote unquote, new full-time hires that needed to be calculated into future budgets, not just this year's budget. So that's what school districts are at least saying. It's a good question, and we can bring up the county executive's proposal and a little bit more of a blurb on that as we run through the rest of the stories. But then let's just hop back into what we had over there, I think, with the next one. Maybe. Well,
you're talking about school districts. I'm curious, and you might know. Now, a municipality, or let's just say a town, turns down their budget for the school. Mm-hmm. What happens now?
That is a good question, and that I'd like to get a little more fleshed out by a reporter who covers that local kind of level of kind of government. But I believe they're going to have to come back and they're going to have to find.
I don't think they go through. I don't think they go through the process again. If they've turned it down, it goes to some algorithm.
You think it goes to a default?
They either drop the music programs and the sports program. They shave things off the budget.
Yeah,
and it all. I don't think. I don't know. I'm not really sure, but it was kind of like it's the catch-22, because if you pass the budget, okay, you're going to pay the higher taxes. Now you're going to do. If you don't pass the budget, it's going to pass somewhere down the road, and it's not going to be the way. Yeah,
exactly. And you're going to lose to have say in where the money comes from. So that's a good point. Let's make sure that we do get someone. I know a couple of people have been following the school board elections pretty closely at Newsday. The school districts have also had some issues recently with some allegations of bias-based incidents. So, and the school board elections, and that's why, like I said, let's hopefully have someone on soon who can give us a little more of their reporting, because there was a lot of campaigning around the school board election process this year, and some of it, at least according to what I was reading, had gotten pretty ugly. Kind of
in two Long Island school districts, the incumbents were swept out.
Okay, so that's interesting to know. But
that was Smithtown and Port Washington.
Yeah, but the school districts, as opposed to a regular year when it's just maybe the numbers and what do you do with the after school programs, there had been, as my understanding and what I read, a lot of kind of politicization of both the mask, the mask and COVID kind of issues in terms of people who wanted to push ahead and completely ignore anything, and other people who were being a little bit more kind of hesitant and conservative in the reopening process. So there was that. There again were some other alleged racial undertones and kind of again these mailers and campaigning. So there's a lot to it that we'll have to get someone on to digest a little further. But I just wanted to give people that general update on where those stood, those school board, budget votes. So, Bill, go ahead to the next story. I'll be right back with you. Go ahead.
Which one? Let's see. Yeah, let's see what we got here. Oh, here we go. This story, very interesting. Long Island towns are exploring new avenues to address the sale of marijuana, including possibly putting the matter on the ballot in November. Town supervisors from Nassau and Suffolk counties, along with leaders from the cities of Glen Cove and Long Beach, met virtually on May 5th to once again hash out how they would address the new state law legalizing recreational marijuana. Officials had met a month prior, but could not reach a consensus on whether they would fully participate. Under the law, which passed in March, a municipality cannot prohibit residents from consuming or growing marijuana, but can opt out or regulate retail sales and consumption sites. If opting out, a municipality must pass a law by December 31st, stating its intention to do so. A municipality that opts out can opt in at a later date. So if a town or village opts out, a permissive referendum to reverse that decision can be held if residents collect signatures from at least 10% of the total votes cast in the municipality for governor in the last election. Well, during the meeting, supervisors from Southold and Southampton discussed towns opting out and then directly putting a referendum on the ballot for November, bypassing the petition. New York's law legalizing recreational marijuana allows municipalities to opt in or out of retail stores and consumption sites. And municipalities have until December 31st to pass a law if opting out. So a municipality cannot prohibit residents from consuming or growing marijuana. Municipalities can regulate where retail stores and consumption sites are located. Southampton Town Supervisor Jay Schneiderman says he's not sure what direction his town board will take, but that he feels putting it on the ballot is the most democratic way to approach the issue. Yeah. So this is a biggie, so everybody, we all celebrated, everybody, the villagers rejoice, they legalized recreational marijuana. But what did that really mean?
Well, there's always going to be a little bit more to it. And even folks, again, because, you say everyone, but obviously some people aren't as open to this change as others are, we'll say. Mm-hmm. But in terms of, when we spoke even with the town of Oyster Bay supervisor, Joe Saladino, that's kind of what I guess he was leading on to, that, people, his voters might think, oh, well, do something about this, stop this from happening, but right. Again, at the same time, at the state level, it's already been made the decision. And as he referenced and as the article discusses, the real main kind of tool that folks who aren't, again, as friendly to this issue can take is using zoning and putting these types of establishments in only certain areas that, in their minds don't impact the character of the community or something like that. So that's an important point.
Well, I think it's going to be interesting to see because those, I don't know if these are tied together. The idea that if you opt out, then you also opt out of the tax benefit of the money that's generated by the industry. If the marijuana industry starts hitting the $1 billion mark, and I could see all of those towns, I call me cynical, but they're all going to opt in when the cash starts flowing. Well, the other thing too is that a lot of banks are not set up to accept money from the marijuana industry because, traditionally it's been cash.
Well, again, it's been an illegal market, so you can't have, an illegal business, whatever it is,
right.
Running through.
But because that's where it started, but because of where it started, they've always had this, been at loggerheads about, you can't put that cash in the bank, and
that will, in my understanding, still a bit of a layman, but that'll probably need to take a change at the federal level to allow, both FDIC, when you deposit your money in the bank to basically cover that, and again, not have it basically be laundering, I think is kind of, the argument. But I do know, from my understanding and reading about this, in other states, that things like credit unions, they have had a little more wiggle room, and they've been able to, because they're, member run, they are, predominantly back, kind of back. But at the same time, because they're member run, they can kind of make more decisions that, again, I don't think they're going to do it for, your kind of seedy dealer down the street who's running it out of an abandoned house. But if you have a legitimate company and you have a legitimate kind of business model and you're someone who's trying to show you're a net positive for the community, especially in that medical space, I would think that there is again, the ability to use things like credit unions or some other kind of financial institutions that are outside the mainstream. Things like online, I guess, banking to an extent. I don't really know. But like I said, we can ask more. This story, again, was by, I believe, Denise Bonilla. Like I said, so there's a lot more to find out what's going on here. But,
so we'll keep that. We'll keep that in mind.
Yeah, the date is important.
Let's go into Scott's story here.
Exactly.
Scott Eidler reports that New York Attorney General Letitia James criticized Nassau County's failure to create meaningful checks on law enforcement because county officials in a police reform plan did not propose a civilian review board to probe allegations of police misconduct. That, according to a letter obtained by Newsday. In an April 13th letter to 3 Democratic Nassau County legislators, James said that she would give special scrutiny to jurisdictions such as Nassau, where formal oversight is lacking. James said that she shared the lawmakers' concerns about the failure to create meaningful checks on law enforcement in Nassau County and support your efforts to ensure that the appropriate oversight bodies are created. Legislative Minority Leader Kevin Abrahams, the Democrat from Freeport, Legislator Ciela Bino, the Democrat from Westbury, and Legislator Carrie Salages, the Democrat from Lawrence, had written to James asking her to open a regional law enforcement misconduct office in Nassau. In her April 13th response, James said that there was not enough funding to open the office. So a spokesman for James' office did not immediately say whether the letter applied to the police reform plan filed by Suffolk County. Suffolk's plan also lacked a civilian-led review board. It gave the Suffolk Human Rights Commission authority to oversee complaints about police conduct, but investigations are left to the Police Internal Affairs Unit. They're not going to let that go. They don't really want to let that go, do they?
No, it seems to be a main sticking point that CCRB, I know activists were calling for other things too, the discussion about qualified immunity and these other measures. Right. But in terms of the CCRB, I know that New York City has one. Some people will say, okay, well, it isn't that effective. Some people will say, well, maybe it has too much power. People give different arguments about that. But I don't know. It's interesting to see that Suffolk took the approach that they took, which was to, again, put a little bit more oversight responsibility with the Human Rights Commission, which kind of makes sense. But then also, investigations still being left to the internal affairs, still kind of doesn't.
Tell me if you think, do you think, you can have all of the groups or commissions and organizations, if the people that are in the driver's seat in those particular offices, if they don't have the political will or the wherewithal to do the job, that simple, then those commissions and those offices they're ineffective and they may as well not exist.
It's always one of the arguments, but I guess, some folks will say, well, there is no problem, which is, again, back to this contradictory.
Well, the numbers purely state that there is a problem.
Oh, no, exactly. That. No, exactly. I think, there's enough, evidence that there is an issue.
When we talk about numbers, I always go back to, and it sounds stupid. No, that's okay. I'm not afraid of being, seemingly stupid. When they asked Stephen Hawking if he thought there was intelligent life out in the universe, his answer was, listen, I'm a mathematician, and the numbers simply state that there has to be. No, billions of stars, billions of planets. It's the same thing with what's going on in the country. You have a disproportionate amount of the population dying, and as a direct result of police intervention. Yeah, you can't ignore the numbers.
No, and there's been historical realities, things like the disproportionate incarceration rates for similar crimes like marijuana, which we just discussed, obviously knowing that, clearly people of color, minorities really aren't using it at a higher prevalence rate than their white counterparts. Go look at any college campus, again, as we've, discussed that before. But, it is interesting. And, it was good to hear more information in that Scott's reporting at Newsday was able to find out, again, what kind of was being said by the Attorney General to the local legislators out here who, again, were still fighting for those changes. it's I don't know. It's going to be something that, and the next time we have on, the commissioner, and I know we referenced it last time, that, it's reform isn't something that's static, where it just says, okay, well, we reformed it.
Yeah,
and
right.
now we're done. It's something that, again, okay, it's a give and take. Again,
well, you got to reform it, and then you got to look and see what the results are, and then you got to reform it again, and then you got
exactly. So we'll go on to more of that in the future. But I just wanted to mention a quick kind of update that's kind of from the city, but would definitely impact Long Islanders directly and is related to policing in specific.
Oh, that's right.
Yeah, in terms of, I don't know, a lot of our Long Islanders, we're watching our own kind of races, if we even are, for the legislators and the executive and stuff coming up, obviously either in the primaries or the generals this year. But interestingly, in New York City, at a recent New York One televised public debate with all the candidates, all of the Democratic front-running candidates, I believe all of them who took part in that event, have committed that if they are elected, they would require New York PD officers to only live in the 5 boroughs, which inversely means that no Long Islanders from Suffolk or Nassau County, in theory, would be, I assume, allowed to join. I don't think they're going to, disbar everyone and say go back to Long Island and NYPD, but I think they'll get grandfathered in.
Is it a realistic thing to say? Listen, I have relatives that lives in Queens. All of a sudden, I live there. While I.
Again, I don't know if it's just hearsay, like I said, and it's just campaigning, and
what will that mean?
As the police commissioner. No, exactly. I don't know if you can put someone who's going to say sure, but it's just interesting because it's the first time that they've ever said that in a New York City mayoral race.
Oh yeah, no, I'm just curious what they think the benefit is. What you think what now you can wake the cop up in the middle of the night?
No, it's not that as much. It's not that. I know talking again. It's like what Commissioner Ryder said. It's the community policing aspect. It's the old, okay, well, I know Officer O'Reilly. Mm-hmm. He lives down the street from me, and I played in the youth basketball league with his brother, kind of thing. I think that's the argument that Long Islanders say they want Long Island officers too. They want officers who know their communities. Part of it, I guess, like you said, is not having to have someone drive from up in Orange County, but. Like I said, there are a number of considerations that need to be addressed, and that's just one that did stick out. Knowing that, again, it looks like 33% of NYPD, about 35,000 members, live in Nassau or Suffolk County. So that's a lot of folks. That's
here's under various proposals which would require a change to state law. New cops who live outside the city would need to move in and stay for at least 2 years, if not longer.
I see.
Or be disqualified from the job. I can't see a guy selling his house on Long Island to go and live in Queens for 2 years and then want to go back out to...
No, the opposite I've seen happen sometimes. They do, like a lot of PDs and out of state, they'll kind of advertise to NYPD and folks to say, hey, you want more land? You want, this, that, and the other? Come down to Maryland. Come down to...
yeah.
So we'll monitor that, but it was something that was interesting to point out, certainly.
The other thing is that while a similar mandate is already in place for most municipal jobs in the city, I didn't know that. I didn't, cops, along with certain, like firefighters and jail guards, can also live in Nassau, Suffolk, Rockland, Westchester, Putnam, or Orange counties.
Mm-hmm. Yeah. No, exactly. So I don't know if it would just be in this one application or others, but either way, that clock is ticking away. I do just want to mention, just for folks, they can find out more on our social media at This Week's Long Island News or at TWLI News. But just keep in mind that the New York Excelsior Scholarship Program, which would allow full-time students at SUNYs or CUNYs to apply for tuition-free education, that application is now open for the fall semester. So go check that out. We'll put that up on our social media and a bunch of other stuff, some events coming up like prescription med drop-offs and other things that are important. So another thank you to Dr. Larry Eisenstein and to the county for his time. We really appreciated his conversation and the information he provided. So thanks again.
Very cool. And we'll see you next time right here on 90.3 WHPC.